Okay, my name is Lafayette. The community health issue that I'm going to be discussing and presenting is HIV/AIDS, more specifically HIV, with a variation of AIDS and awareness, more so differentiation, because particularly most people think they are one and the same when they are connected and linked, but they're not the same illness, condition, or disease. Although they are connected and branched in a way where if one is not controlled, the other follows. But that takes a long period of time and inconsistency when it comes to medications and healthcare. So HIV/AIDS is something that is not just community related in terms of something just relevant in Philly or New York or LA or down south. It's something that is impacted by a group of people, uh, not just a group of people, but essentially just different variations of people in different areas, not just in the States, not just in certain African countries, but this is something that is impacted by individuals throughout the world. Obviously, most countries have more exposure or more rates or more an inability to stabilize the condition in terms of healthcare and um, resources. But this is something that's also not gender specific, it's not identity specific, it's not race or ethnic specific, because anyone, regardless of race, ethnicity, gender, identity, for those who are non binary and classify themselves differently than others, and in general, this is not specific to a particular group of people. Obviously, there are some people who are or who can be more susceptible or more affected, depending on environmental standards, factors, and situations that may occur, um, which goes into regards of susceptibility and exposure. Since 1981, over 600,000 Americans have died of AIDS. Um, that's more than the U.S. combat deaths since the beginning of World War One. Since 2006, the UN AIDS report has reported that the number of affected people in the U.S. has reached the highest level ever, an estimated of 1.2 million. Um, and yeah, this is 2006. So in connection, I already said approximately 1.2 million people in the U.S., United States, for short, are living with HIV today. About 14% of them, 1 in 7, do not know it and need to be tested. Don't know it, and they don't know also the necessity and the importance of getting tested, because essentially HIV specifically, not AIDS, but HIV is a condition or illness. Condition and illness is condition is more appropriate, but it's a condition where there are not many symptoms that show face. With AIDS, it's usually when the CD4 count is below 200, and which makes a person more susceptible to being infected or affected by other illnesses. And then, of course, there are a lot of symptoms that go with that. But HIV, in general, HIV, the virus, human immunodeficiency virus, is essentially an illness or condition that does not usually show symptoms. So it can take someone some years. Someone could live up to 10 years, essentially, or even I would say 5 to 6 years, without knowing that they are positive. They don't get tested because there are no particular symptoms, and even if there are symptoms, the symptoms are very much flu-like or cold-like symptoms. So it'll be hard for someone to rationalize the idea or perception that they are infected with an STD, specifically an STD like the HIV virus. So essentially, there is still stigmas when it comes to HIV/AIDS promotion, and in terms of trying to get more people to get tested, and um, variations of advertisements when it comes to demographics. Essentially, HIV continues to disproportionate impact on certain populations, particularly racial and ethnic minorities, gay and bisexual men. A lot of times there is still a stigma of HIV spreading and HIV concerns when it comes to the LGBTQ community, and a lot of times even bisexual men also get a lot of those stigma remarks, and even in like promotion when it comes to advertising, and they can be a little bit more biased, which can affect the way other groups like heterosexual people, and people who engage in heterosexual relations. It can alter the way they view the importance of testing, and the importance of spreading, and the importance of alerting your possible future, past, and present sex partners about the relevance of testing, healthcare, and minimizing exposure. Okay, so an estimated 36,400 new HIV infections occurred in the United States in 2018. In 2018, about 37,000 people received an HIV diagnosis in the United States, and 6 dependent areas, and overall 7% decrease compared with 2014. The HIV diagnoses are not evenly distributed across states and regions. The highest rates of new diagnoses continue to occur in the South. Specifically, when it comes to reference and statistics for the Philadelphia region, there are an estimated of 30,000 people living in Philadelphia with HIV. Philadelphians are being affected at a rate 5 times the national average, and are being infected at the rate more than 50% higher than residents of New York City. New research indicates that among many groups, individuals ages 29 and younger are in the majority of young people that are affected sexually. And approximately 20% of people infected with HIV do not know it, like I said earlier. One misconception of HIV is that, well, initially in the past, it was stated a lot of times when learning about the virus among healthcare professionals, scientists, researchers, there was a perception or a false narrative that it was airborne. At one point, there was assumption made or spreading of false information stating that only LGBT people and sex workers were the ones who could possibly spread and the virus and become infected by the virus. And in the earlier stages, a lot of people were kind of confused on how the spread of the virus was progressing so quickly, and a lot of times they were trying to find different methods of research to find different variations of how the virus was spreading, how it came to be, and which groups were affected the most or primarily. A lot of the spreading occurred through obviously in like a multitude of portions sexually, but more so through blood transfusions and needles, essentially with possible drug exposure or transfusions, essentially in the hospital. Another misconception is also that the idea of how it spread, because essentially someone, for example, who is HIV positive in the earlier stages is more likely, if they have, it depends on the the CD4 counts and the level or the stage of the HIV condition. Because essentially, most people who, for example, who are newly diagnosed, depending on when they were diagnosed, may have a higher CD4 count or a lower CD4 count. Okay, yeah. So, yeah, essentially, it just all depends on the level. Essentially, I want to just say that the person's condition and ability to spread the virus depends on the CD4 count. If someone has a CD4 count for 100 and above, they're less likely to contaminate, spread, or infect someone else with the HIV virus, which means that they are undetected. Anything below 500 or below 400 essentially, or 450, it depends, is essentially considered detected. And necessarily, like, specifically someone who's undetected cannot spread the virus or has a low likely chance of spreading the virus. I think specifically the number is 0.01% chance of spreading the virus, which is very, very low. That means the person can also have a healthy sex life, a healthy will also initiate the fact that their sex partners get tested and practice safe sex, because there's other illnesses and conditions, and there's also risk of pregnancy if you don't want to be exposed to that. But these people can also spread. I mean, no, not spread. They can also have healthy relationships. And also the misconception also was that someone who is HIV positive will transmit the virus to someone or essentially their child. Even in towards the late 90s, there was medications and implements of procedures in order to prevent mothers from contaminating their child at birth or during pregnancy. Now we have more methods of that, more procedures and medications for that, for mothers, more wider range of medications that help mothers successfully put to term or complete their terms with healthy children. And mothers can also breastfeed their babies if they want to. There's also a means for medication or of medication for that as well. And yeah, all in all, I just want to I brought this background information up to share a little of a basis of how some of the conceptions of HIV is misconstrued, and also how a lot of these people are stigmatized still in today's age because of the lack of awareness. And a solution I would pose to this is possibly using media outlets, since people are more into media forums and learning about things through their phones and other technology resources. Using media and talking to people who may be positive and also people who have experiences with positive people allows you to have an open perspective of how the virus works, how it affects people individually, and how it affects those who are infected and living with it day by day in their daily lives, whether they were born with it and positive and are undetected, which means that they can't spread it towards anyone else. They still have those stigmas that they face coming out and being open about their experiences while dating and developing new relationships and aspirations or affirmations, and also posing the importance of getting tested, because just because someone is HIV positive, that doesn't mean that they shouldn't get regularly tested. They still need to go for yearly checkups, sometimes every 6 months, sometimes yearly, depending. If you're undetected, you don't have to go every 6 months or even more frequently as someone who would be newly diagnosed or someone who is still trying out medications, which we have 100 medications now for people who have a variety of different reactions to the medications. Back in the 80s and the 90s, a lot of medications were not as diverse. There was a small selection of medications and it didn't go with a lot of people's bodies, and a lot of people had very bad reactions to it, which caused a higher risk of death and higher not exposure, but a higher rate in terms of being able to stabilize the condition at the time, because there was a lot of discrimination and just lack of medication in terms of funding and research, and there wasn't a priority to fund and research so soon and at an earlier rate because of the stigma of it being tied to the LGBT community and sex workers. But now we have more resources, more information. We're still researching more about it, and it poses the importance of practicing safe sex. There's latex condoms, non-latex condoms for people who are allergic, and a lot of times people are coerced to not use condoms because of latex allergy or because of manipulation and other environmental standards that may not be taught or prioritized during sex ed or sex experiences, and posing the fact that a lot of Philadelphia in general has a high rate of HIV exposure or HIV infections. It poses the importance of practicing safe sex and getting tested every 6 months or every year, and asking partners or potential partners to also get tested, and also prioritizing the idea of that of educating yourself if you do encounter people that are positive, and also talking to your doctor frequently about resources and perceptions of PrEP. PrEP is more so for people who are newly diagnosed or are not undetected, or for people who are possibly undetected or not undetected, but the partners are still learning about the awareness of it, and the education of the virus. And so essentially that can maybe, if they still have fear and possible concerns, they may also use PrEP for their protection. But there's different standards and different ideas of how to protect yourself, and also how to stay alert and stay aware and be open-minded to people's perspectives and experiences. And it's important to protect yourself, because at the end of the day, there are people who still have a fear of going and being open about their sexual experiences and sexual exposures. And essentially, it's important to ask questions. Be open to be open to asking questions. Be open to getting tested, and prioritizing that your partners get tested, and practicing safe sex, and also asking your doctors questions, and implementing concerns and health resources and opportunities as well.